Hello, my name is Jenna Philippone, and today I'm going to discuss neural tube defects. Please make sure that you open the attached PowerPoint to aid in this presentation. I might struggle pronouncing some terms, so please bear with me. Today's objectives are: I would like you all to be able to define the term neural tube defects, identify the causes of neural tube defects and the frequency that they occur, understand the effects of meningocele on the body and the effects on children's physical abilities. We will be focusing on this form of neural tube defects. Explain the many ways for intervention and the ways to provide care and support and the ways to help establish independence. Be aware of the teaching techniques and to help guide you in your classroom. Neural tube defects are malformations that occur on the spinal cord, brain, and vertebrae. There are three types of neural tube defects, which include anencephaly, and spina bifida. The first of the three, anencephaly, this is a neural tube defect that causes a malformation in the brain, causing it to protrude. It usually is seen in the back region of the brain. However, they can also be seen in the front of the brain, about where your forehead would be. The malformations that are seen are masses in the nose or in the eye socket. These types of malformations are a rare occurrence. The side effects of this neural tube defects include intelligent disabilities, fluid in the brain, and seizures. Anencephaly is a neural tube defect that is a cognitive malformation in the brain and skull, preventing the neural development. It is common to see stillborns and deaths soon after birth. Spina bifida. This is the most common neural tube defect. This neural tube defect causes a split in the vertebrae arches, seen in either the bone or the meningeal sac, which contains part of a protruding spinal cord. Okada is the most benign form of spina bifida, affecting only 10% of the population. There are no visual signs of this malformation. Types of spina bifida. There are many types of spina bifida. Spina bifida is the most common form of neural tube defects, and there are a couple different forms of spina bifida, which include Ocott spinal dysrhaphism, meningocele, and meningocele. The first of the three, Ocott spinal dysrhaphism, is also known as OSD. This neural tube defect is an abnormality caused by a visual red mark on the lower back, which is seen as a reddish birthmark. This red mark is thought to be the result of a spinal cord getting connected to the surface, which leaves big risk for infections since there is an open wound. If a child is born with this, immediate evaluation by MR or ultrasound should be done so proper care can be provided. Meningocele. This is the second type of spina bifida that we're discussing. This type of spina bifida that is characterized by exposing the sac covering the spinal cord. If you look at the pictures, it will help better explain this. The spinal cord is not trapped, and the children with this neural tube defect express no symptoms. Meningocele This is what we will be focusing on today. So anytime we are talking about a neural tube defect or spina bifida, this is what we will be discussing for the rest of the day. This type of neural tube defect is characterized by having an exposed sac covering the malformation. Sometimes the spine is visible at childbirth. Some side effects include paralysis, sensory loss, hydrocephalus, and abnormalities of the brain, which lead to learning difficulties. This is the most congenital malformation compatible with life, and it is the neural tube defect that we are focusing on today. So anytime, once again, that I reference spina bifida, this is what we will be discussing. Next, we're going to discuss the prevalence of neural tube defects. The prevalence of neural tube defects varies from country to country. The U.S. has less cases than other countries like North Wales or Ireland. In the U.S., there is 60 out of 100,000 chances that a child will be born with Menocelli spina bifida. It is caused from a genetic defect in a certain ethnic group. However, environmental factors, maternal age, and socioeconomic status all have an impact on it. As I said, it depends on different areas like Ireland and North Wales, is because we have fortified our food with folic acid and we are taking supplements. Overall, the prevalence of spina bifida has decreased over the years due to better testing and prenatal screening. Doctors are now able to test women during pregnancy for neural tube defects and provide the necessary aid if they are detected. Foods are also being enriched with folic acid, which is also given to women as a supplement during pregnancy. Even though there has been an overall decrease in neural tube defects, there is still prevalence because the overall survival rate of individuals with spina bifida has increased due to the improved services and treatment available for them. At this point, you're probably wondering what causes neural tube defects like spina bifida. Well, if you turn to this slide, you're going to see that a picture of the spine and its closing, and that's going to help better aid in your understanding. Well, the overall causes are uncertain, but scientists believe that it starts 26 days after fertilization of the egg. At this point in time, the central nervous system is beginning to develop, starting with the neural tube folding over to make a spine. During this time, malformations can occur, causing the neural tube to not close completely. The neural tube has many points along it. So, unlike a zipper that closes from the bottom to the top, the neural tube closes at random points, each point having a different genetic code control. The causes of neural tube defects are both genetic and environmental. There have been genes identified to increase the risk factors, however, it is only a small percentage. Other causes include chromosomes disorders, which I actually discussed in my previous presentation, where things are deleted or duplicated, or it could be caused by exposures to anti-epileptic drugs and acne medications and excessive use of alcohol. My mother, being an epileptic, she actually took medications, and one of the side effects was that I was supposed to be born with many different variations of side effects, and one of them was spina bifida. Maternal issues can also cause neural tube defects. These include exposures to the mother being exposed to hypothermia, having diabetes, or being obese. The risk factors for having a child with neural tube defects increases with your age, your ethnicity, and your gender. Overall, scientists are not sure if neural tube defects is caused from the defects in the malformal spinal cord or from malformations caused by the inflammatory effects of the cord being exposed to the amniotic fluid. Prenatal testing and surgery can allow for less severe malformations, however, it is extremely risky for the mother and the fetus. Well, how do we prevent neural tube defects? Prevention is key. Neural tube defects can be prevented by using folic acid supplements. Studies show that taking a daily supplement of folic acid has reduced new cases of neural tube defects by 50%. Recommendations have been made that women who want to become pregnant or who have recently become pregnant take 0.4 milligrams of folic acid. They recommend that the folic acid be taken weeks prior to conception and 12 weeks after conception. Now, for some people, this might be a little harder to plan 4 weeks prior to conception, but that is why in 1998, food staples in the U.S. became fortified with folic acid. Even those foods have been fortified with this folic acid, it's still important to take supplements once you know that you are pregnant. Along with taking supplements, it's also important for women to get screened for neural tube defects weeks into their pregnancy. Prenatal diagnosis is important and will be done by one's healthcare provider. Around 16 to 18 weeks of pregnancy, it's important to test the levels of AFP, standing for alpha-fetoprotein in the mother's sternum. This AFP is a chemical found in the fetal spinal fluid in the brain and spinal cord. If there's a presence of AFP, then an ultrasound will be given to detect the specific abnormalities of the fetal head and neck related to neural tube defects. If the ultrasound tests positive, more testing will be done and an amniocentesis is performed, testing the levels of AFP and ACH, both enzymes specific for neural tube defects. If this is still positive, then the chromosomal analysis of the amniotic fluid is taken to rule out the syndromes related to neural tube defects. If all tests are positive, then the parents have two choices to make. They can have a therapeutic abortion, or they can start planning for delivery. And it is recommended that parents who choose delivery do deliver in a neonatal intensive care unit so that the back lesion can immediately be closed, which will help prevent the severity of paralysis on the child. Treatment. If and when the child is born with a neural tube defect, immediate treatment should be provided. During the first few days of life, the newborn will undergo surgery to close the opening in the back, and a shunt is placed in the brain to prevent CSF from leaking, which is fluid within the brain. This surgery will help prevent the spinal cord infection and prevent injury from occurring due to the exposed spinal cord and other related exposed structures. The primary neurological impairments in children with spina bifida are caused by malformations which affect the central nervous system. These malformations may cause many disorders like cranial nerve nuclei, excessive fluid, or splitting of the spinal cord above the point of the lesion, motor impairments, and cognitive impairments. Let's first talk by discussing the loss of paralysis and sensation. Paralysis and loss of sensation, dependent on the location of the lesion of the spinal cord, causes impairment of the sensory motor functions below the spinal cord. All individuals with spina bifida neural tube defects experience some loss of sensation, but the extent of the severity varies. Churi malformations and hydrocephalus. This is when the brain stem and the cerebellum get displaced from the skull and end up closer to the neck. Symptoms include trouble swallowing, choking, hoarseness, stiffness of the arms, disordered sleeping, or just to name a few. Disoriented sleep can be hard to detect, but if the child is seeming to be really tired, having trouble focusing, then you can present the issue to the doctor and the sleep study can be administered. Hydrocephalus, actually, another type of impairment, occurs in 60 to 95% of children and is seen in the central region of the spine. This impairment is caused by an error in the CSF alignment, resulting in enlarged ventricles located in the brain. A CT scan, MRI, ultrasonogram, or neural imaging can be done to detect this malformation. Treatment for this is they can have a shunt placed in their brain. This shunt helps drain the extra fluid found in the brain to the abdomen. It is important to remember that shunts can be problematic, and by the age of 2, half of shunts inserted need to be replaced. Symptoms of a shunt blockage include abnormal head growth, headache, vomiting, irritability, and lethargy. If there's any change in personality, performance in school, or change in physical abilities, an important immediate evaluation of shunt blockage or failure should be performed. As physical educators, it's important that we keep this in mind, that if you see your student is struggling, they're not as with it as they normally would, first thing that would come to my mind is there could be an issue with their shunt. Some associated impairments and medical complications. There's a lot of things, unfortunately, for these children that they will face. Along with the neurological impairments, there's also the associated impairments. And some of these impairments include cognitive impairments, impairments with fine motor skills, gross motor skills, visual impairments, seizure disorders, musculoskeletal abnormalities, spinal curvature, spinal humps, urinary and bowel problems, skin sores, latex allergy, weight and stature abnormalities, sexual issues, dysfunction. But if proper and immediate care is given by the family and the healthcare providers, the severity of all of these impairments and complications can be decreased. Well, let's start with our associated impairments and discuss them in more detail. Some mobility impairments. The higher the level of the melanocytes, the greater the degree of muscular weakness. Some signs of mobility impairments are first seen with the delay in the infant's ability to roll over, sit up, and walking skills. The severity of this impairment depends on where the paralysis is located on the child. The child seems to be able to learn to walk by the age of 2 or 3 with ankle braces, hip braces, crutches, a walker, or nothing. If the child has an L3 or L4 lesion, they will be more mobile through the use of a wheelchair, because the change in the strength in the center of gravity as they develop and the location of the impairment on the spine. Some of the cognitive impairments, it is good to know that 3/4 of children with spina bifida have an advanced IQ score, and only 1/4 have a mild intellectual impairment. It is important to note that very few children with the spina bifida have severe intellectual disabilities, but if they do have them, they result from having an infection in the brain from defects with the shunt or hydrocephalus. Impairments are seen with specific skills including perception, organization, attention span, speed of motor responses, memory, and hand functions. Children usually have a non-verbal disability, which means they are stronger in reading than math skills. They sometimes have issues with the ability to plan, initiate a plan, sequence, sustain things, inhibit competing responses in the pace that they complete their work. They also can have a sign of delay in expressive language and verbal memory. Other impairments include seizures disorders. These are seen in about 15% of children with spina bifida. Seizures are toxicogenic, also known as grand mal seizures, can be controlled by anti-seizure medication. If there is any change or increase in the seizures, tests should be done immediately for a shunt blockage or issue with the shunt. Children also can have impairments with their vision. Impairments are seen in 20% of individuals, and that can be easily corrected with corrective lenses. Some impairments and abnormalities are also seen in the neuromuscular area of the body. These abnormalities include deformed joints due to muscle imbalance or total paralysis. Two areas that are most commonly seen are in the feet and hips. And this is because of the way that the spine is developed. It's affecting the lower region of your body. The feet, the abnormalities prior to birth include a club foot, which can be gradually straightened during the first 3 to 4 months of life. Braces can be worn to maintain the proper foot positioning. Hips, abnormalities caused by muscle imbalance and lack of movement, causing hips to become deformed. Surgery can help, but it is controversial because it can be very risky. Orthopedic treatment is better alternative and can help maintain alignment, range of motion, and provide stability to the spine and extremities. It can provide comfort, protect the skin, and maximize the overall function of the joints. Children with spina bifida are predisposed to bone fractures because they lose muscle strength quicker than their counterparts. So vitamin D supplements and calcium should be given to help prevent osteoporosis and bone fractures. And this is especially important with children who take anti-epileptic drugs because there's a decrease in absorption in vitamin D and calcium. Weight-bearing activities will help strengthen the bones and the muscles. Children also can have issues with spinal curvatures and humps. 90% of children with spina bifida have a spinal curvature or hump. There are 3 types of spinal abnormalities that can be seen, and bear with me with these names. It's scoliosis, kyphosis, and fossosolius. The first of the 3, this is a spinal curvature which can be seen before birth. However, it can also develop during childhood. If left untreated, it can cause issues with sitting, walking, and lung functions. Surgery is needed to correct the curvature in the spine. Metal rods are used to help strengthen the back. 2 rods are used, one in the front and one in the back of the spine. And this is used with individuals who have less than 75% of a curvature. The second type, this is a spinal hump, which can also be seen before birth. However, it can also develop during childhood and can compromise movements and lung functions. The surgery can be done to remove the hump, and it is recommended to be done when the child reaches school age. The third neuroskeletal abnormality is a combination of both a curve and a hump. Surgery can help the tethering of the spine in both the scoliosis and the kyphosis, but it is important to be proactive and get help as soon as any issue arises so immediate care can be provided. With this whole thing with spina bifida, immediate being proactive and not reactive situation is going to have a huge impact on the outlook of the child. Children with spina bifida have issues, urinary and bowel issues. The urinary dysfunction, these are seen in all children because the urinary tract as well as the bowels are connected to the nerves within the spinal cord. Children can also have kidney malformations as well. The bladder function includes storing urine to produce by the kidneys and emptying the bladder once it is filled. Children struggle with these functions, and if they do, it can cause kidney and bladder infections and even kidney damage. It can also increase the risk of developing adulthood cancer of the bladder. If it seems that there is a urinary dysfunction, evaluation can be done by an ultrasound or a cytomegalogram. And if there is a dysfunction, intermittent catheterization, CIC, can be placed in the body to help drain the bladder. If it is an infant and they are having trouble urinating, then a vasostomy can be done to help drain the bladder. 70% of children who receive this CIC and medication together can achieve cognitive contingence during elementary school, and if for some reason they have not achieved the ability to control their urination, then a surgical procedure can be administered. Bowel dysfunctions. These are caused by improper functions of the kidney, anus, and lack of rectal sensation. Children also experience constipation followed by intense diarrhea. Children also soil themselves because of the lack of rectal sensation. Bowel management can begin at the age of 2 or 3, about the age when children are being potty trained. If no bowel movements are being made by the child, 3 things can be done. First, they can be given daily laxatives. They can be given fiber supplements. And third, they can be given nightly rectal suppositories or enemas. If the child has a slight rectal sensation, then biofeedback training can be administered. I've actually known and babysat a child who has spina bifida for the last 5 years, and starting when he was 5, he's now 10 now, so many of these things that I discussed with you, I have seen, and I have experienced him having issues with these things. Skin sores are caused by an inability to feel the pain of weight-bearing surfaces like the feet or the buttocks. Skin sores become a frequent problem with young children when humps, bruises, scrapes are more common. If there is a sore and it is not treated immediately, a child may have to be hospitalized. They will have to receive surgery to remove the dead tissue. Here are some rules for dealing with a child who has spina bifida. I feel it's important, especially in PE where injuries can happen. Always examine the skin regularly and check for sores. Make sure that tight shoes and braces are being replaced. Avoid hot baths. Provide protective footwear to swim with. Don't allow young to crawl on rough or hot surfaces. Make sure the wheelchairs are cushioned properly and they continue to provide cushion. Individuals who are wheelchair bound should have modified their wheelchairs with an adapted seat so that they do not get sores from sitting. Overall, the best treatment for skin sores is to be proactive and prevent them as best as possible. Weight and stature abnormalities are seen in children with spina bifida. They have an increased risk for obesity, and studies show that 1/3% of children are overweight because the inability to stay active. So it's very important for children to continue to participate in the physical activities and strength training activities, aerobic conditioning activities. They should also limit the amount of fats and sugars they intake to prevent the risk of obesity. So talking about in health class, the reasons for eating healthy would highly benefit these children. Along with being overweight, children are commonly short-statured. Human growth hormone can be given to select individuals, but it may not always be effective. Children also have issues, sexual issues. And there's complications with individuals who have spina bifida. In males, 3/4 of males are able to actually have an erection, but they do not have control of them. This can be fixed by a penile implant, and it is important to note that 2/3 of males with spina bifida do not have sufficient sperm in the ejaculation to prevent fatherhood. They actually do. They do have enough sperm. And using IVF or artificial insemination, childhood or fatherhood can be seen. Females can experience a decrease in genital sensation and produce less sexual stimulated lubrication during intercourse. However, they do have normal fertility, and if sexually active, they should take the same precautions as anyone else in preventing STDs and pregnancy. They can experience earlier development of breast, and this can occur about 1 to 2 years earlier than their female counterparts. And it is important to remember that pregnancy can pose threat to females because of urinary tract infections, difficulty delivering vaginally, the hips can be displaced, but most women do have little or no complications as well, as long as prevention and people are informed of the issues that can occur. Children with spina bifida have 50% of them can have an allergy to latex. Doctors aren't sure why, but they believe it's because of the multiple surgeries that these children encounter during childhood. The risk of the allergy increases with age and can be life-threatening. So it's recommended that all surgeons, dental workers, medical workers, as even PE teachers, that we make sure that all of our equipment and supplies and first aid stuff is latex free. All balloons and rubber balls, Band-Aids, ACE bandages, they need to be latex free, so that we do not have any allergic reactions. Neurological deterioration. There's a visible or noticeable deterioration in any neurological function in the individual with extremely important, and it's extremely important that immediate medical attention is provided. 2 things should be evaluated, and they include evaluation of the structure and the function of ventricle shunt and evaluation of the posterior fascia and spinal cord. It's important to be proactive with any issues that arise regarding the well-being of a child who has spina bifida. Well, after you've learned all about the abnormalities and disorders that can arise from spina bifida, what are some things that we can do to help these children? Educational programs are provided for children. These programs are referred to intervention programs and should be started when the child is about 6 months old. They should be given sensory motor assessments, which evaluates the child's range of motion, muscle tone, sensation, their strength, their bulk, their postural control. The programs can also provide adapted equipment to help the children and families. Once the child is in school age, psychoeducational tests should be given. This helps identify the child's strengths and needs, helps the child develop realistic goals and expectations, and helps develop an IEP for the child, and can allow for the school to provide physical therapy, maybe occupational therapy if needed. Like all schools, children need to be evaluated yearly so that the IEP report can be modified and adjusted. Children with spina bifida also suffer from psychological issues. So they have poor self-esteem because of their physical inabilities. They have poor peer relations in schools and communities. Teenagers often are more socially immature, passive, less dependent, less physically active. They seem to isolate themselves more often, have a high expectant rate of depression, and start developing learned helplessness. So it's important to help children by being aware of the issues that they face, know their strengths and their weaknesses, develop ways that we can deal with their issues and support to help carry out some of the strategies to help them cope with some issues that they may have. It's important that you approach it as a multimodal approach through counseling, exercise programs, medications. Work together as a team to help battle any issues that these children may face. Interdisciplinary action management is also important to provide therapy to children to correct any secondary emotional or physical problems that can arise. Through the family and the healthcare providers, the schools, they should all be working together to help enhance the child's life. And it's also probably very important that the family seeks a financial counselor, because it is very costly and the medical expenses can be very overwhelming at times. It's important to note that the survival rate of individuals with neural tube defects like spina bifida has improved in the last 50 years. There has been a 10% increase in survival rate from 1950s and an 85% increase in the 1990s. As teachers, I feel that it's important that we first get to know our child, create a strong rapport with them, be an outlet for them, be someone that they can turn to and seek advice, support, and guidance. Especially important during the teenage years, where they're going to retract and be more isolated. There can be even a more noticeable decline in self-esteem. It's important to know the severity of the child's neural tube defects, know what they're able to do, what they may struggle with, maybe ask them some activities that they may enjoy doing, or some activities that they really prefer not to partake in, but still encourage them to try their best at anything that they do. It's important to modify the equipment, the rules, the activity space, and the overall activities that are played. It's very, very important that there is no latex equipment being used in the gym, or any first aid material. Make sure that the latex is away because they have a severe allergy. If there is any change in the child's personality, their behavior or performance within the gym or your classroom, an immediate evaluation needs to be done, because there could be an issue with the shunt. There could be a blockage or failure, and an evaluation needs to be performed. And overall, it's just important to be proactive if any issue arises with the child in regards to their well-being. Just a quick summary to talk about what we did today, or discuss what we did today. A sac protruding from the spine creates the most complex birth defect compatible with life. Loss of sensation are commonly seen because below the defective region, many disabilities arise because of neural tube defects, and early action and intervention is key. I hope that you have learned what a neural tube defect is, the frequency of it, what causes it, the effects of the neural tube defect on the body and the physical activities, ways for intervention, ways to provide support, and ways to help establish independence. And I hope you have thought of or learned some ways that you can provide support within your classroom. I thank you for the time to view my presentation. I know it was long, so I thank you very much for viewing this. But I hope that you were able to take away some good information regarding neural tube defects. So if you have any questions, please feel free to ask me. Thank you and have a good day.